Welcome back to the Voices of Healthcare Equity. This is part 2 of our conversation with Luká Yancopoulos of Grapevine Technologies. In our first episode, Luká talked to us about the why behind the founding of this amazing healthcare supply chain company and all the reasons why this innovation continues to need to exist and grow and help us be a more resilient healthcare system, as well as one that's prepared for future and current disruptions. Welcome back, Luká.
Thank you. I'm glad to be back.
Awesome. So, you told us this wonderful how, and we talked about all the reasons why healthcare supply chain really needs to be changed, upgraded, strengthened, interconnected, disintermediated. What a word.
Yeah, it's a lot of syllables.
Yeah. Tell us a little bit about the how. How did you come up with your solution? And where are you now with what was a pandemic preparedness intervention, but now is a medical supply chain innovation for the future?
Yeah, like I said in our last episode, taking a step away from the problem and everything that we had learned in a short period of time gave us a little time to reflect and get some perspective. And we went to the drawing board on how structurally, right, like from a bird's eye view, from manufacturer to consumption of, to implantation of a medical device or use of a suture or whatever, how that should flow. And we drew something up that would be much more efficient and much more robust for the end consumer. We launched Grapevine about 18 months ago, and we had re-engineered from a bird's eye view what healthcare supply chain should look like, from production of the product in the manufacturing facility all the way to consumption, use of the suture on the patient's wound or implantation of the medical device during an operation, right? We saw the supplies, how they could move from manufacturer to end user, how we could keep those ends of the supply chain, right, in sync and in harmony better. And by doing so, both make healthcare businesses stronger and more resilient to disruption events or emergency events, while also driving down the cost of supply. So we rolled this thing out, again, from a bird's eye view. It looked perfect. It solved all the problems that we understood. But when we presented it 18 months ago to our first sort of, medical practice office managers, practice admins, we were met with a lot of resistance. And we couldn't initially understand why. Why would people not want to save enormous amounts of money? But in listening to the customer, right, like listening to the things that they actually did today, the things that they appreciated about their existing workflows, and the things that they really were bothered by that they wanted to see change in, we met them at a moment that we call 11:59 p.m., which is the edge of today, where today meets tomorrow, right? In that moment, if you see what the customer appreciates about their existing workflow, what they're willing to change, you bring them to 11:59 p.m., then tomorrow is just another silly minute away. And adopting change or innovative technology is something that can be done more easily. So what the experience is now for a customer and the way that we sort of package it, pitch it, right, explain it to people is very different. The back end sort of engine, and the wheels behind this thing are exactly what it was 18 months ago, but the body of the machine is very different. So today, office managers will very simply link their existing suppliers. They just type in the credentials to their McKesson account, their Shine account, Medline, whoever else. By doing so, Grapevine goes out and retrieves your contacted prices from your contracted suppliers, the suppliers that you're still working with your sales reps. People love their sales reps. They have an emotional relationship with some of their sales reps, especially at smaller practices, they're friends. So we preserve all of that and we read that data into a single screen where now you can shop all of these suppliers at once. And when there's an opportunity to disintermediate, right? 70% of McKesson's catalog is just resold supplies that are already in the US, maybe even manufactured in the US, right? If there's an opportunity to disintermediate, cut out the middleman and his markup, we help you do just that. You, with a click of a button, unlock another supplier, register with them, get net terms, and so on. If there's an opportunity, let's say you add to cart on an item that's experiencing a shortage from your favorite supplier, a pop-up appears to redirect you to an alternative source that has that product, in stock and available, ready to ship. If you add to cart on an item that you usually get, well, maybe there's another source that same exact product can be purchased from for cheaper. In many cases, it's half the price, right? Just letting these businesses compete against one another, these suppliers compete for your attention. It's like taking Walgreens, CVS, Duane Reade, and take all of their, let's just call it like first aid aisles, and stacking them up against one another and letting you see the same products from each of those suppliers, all with their different price tags. Seeing when a stock shelf is empty, well, let's move on to the next one where it's still in stock. So the same ideas and principles are there, but the actual experience for sort of shoppers is very different. And we extend beyond just the sort of like simple shop and traffic cop redirect, if you will, that I've described so far. But that's the initial sort of jump, which is very similar to what people are experiencing and doing today, but simplified. Now all on a single screen and solving the problems before they happen.
Luka, you're not just bringing us innovation, you're bringing us entrepreneurial wisdom about building a business. So even if you have a wonderful business plan, a great why, a great how, and that this is going to help the industry, at the end, you still have to convince an individual human customer that this solves their day-to-day pain. They don't want to know if it's going to solve their pain next month. They don't want to know if it's going to solve their pain next year. They want to know if it's going to solve their pain point today. So it's really important that you listen to them and that you target your intervention to their daily pain point. So amazing lesson. Thank you for that.
Absolutely. And as much as you're, a business leader yourself, Dr. Kim, and as much as I think as business leaders, we like to believe that our entire team might think the same way or have the same priorities, right? There's often totally different motives, for the different people within a medical practice, right? Between job titles, between personnel. So the way that a piece of technology gets handled or used or adopted or even, becomes exciting for the different personnel is also like incredibly important, and making things palatable is as important as making things that are amazing themselves.
Luka, help us speak to a single physician practice. They're running their own practice, so they're not part of a big hospital that's ordering all the supplies, but they're small practice and they're listening and they're going, this sounds interesting, but I don't think this applies to me. I know a little bit from speaking to you before that indeed your platform does apply to them, in addition to a giant healthcare organization, the oncology practice that manages thousands of supplies and dozens, if not hundreds, of facilities. How does your platform, your app, apply to a very small medical practice, a giant healthcare system? What are the similarities and differences?
One thing that we are absolutely aligned on, Dr. Kim, is equity, right? When it comes to healthcare, and making sure that solutions and the most cutting edge technologies aren't left for just the highest bidder, but they're made available to everyone. Because I believe that in this world, all men and women are created equal, everyone are created equal. And it's important to deliver equitable solutions to businesses of all shapes and sizes. With that said, our platform, this Grapevine procurement platform, is totally free to use. Right? It's a sign up and start going. No payment, no cost associated with using this technology. Again, it's totally free. When it comes to sort of the implementation, we see sort of different configurations or different supply chain setups that are trendy for different sizes of businesses, both across different medical specialties, but also the actual size that you're getting to. So the most typical thing for one of these smaller practices, privately owned practice or even a physician group owned practice with a couple locations. But what we see there is they don't have a huge procurement department like a hospital. They're not even negotiating with their supplier. They're typically ordering from truly one supplier, right? So the way that their journey on Grapevine starts is they sign up and they immediately, access Grapevine. We don't want to make it difficult for you to sort of start solving back orders or start saving money. So we will immediately connect those businesses to a sea. They have to opt in, but a sea of more than 500 different suppliers. So the BDs of the world, right? The Medlines of the world, the Henry Scheins of the world. So other distributors, but also other end manufacturers. And with the click of a button, you can unlock these suppliers and turn that linear chain into a vast network. And that happens effortlessly. There's no paperwork. You don't need to have your, lead physician filling out credit applications and handling the accounting, right? You don't need to do any of that. It's with the click of a button. You can get access to 500 or just 5 select, specialty suppliers. And with that, comes the strength of resilience and a lot of cost savings. From there, we like to do things like we're partnered with a number of GPOs. Many smaller practices don't even know what a GPO is, but the idea is those GPOs, they're group purchasing organizations that leverage the spend of large hospitals alongside your smaller practice to use, economies of scale to lower prices with manufacturers. So it's not a matter of dealing with new manufacturers, but we basically get you instantly registered with GPOs. Those GPOs get layered in to the different distributors that you've either linked or unlocked. And suddenly your prices on McKesson's website or your prices on Medline's website, the trusted suppliers that you already know and use, they'll drop, 10%, 20% in some cases, just by leveraging the GPOs. So we do things like, and then from there, that's really where we just get started is with the sort of vendor network. We're able to offer a lot of really cool insights too for like multi-location practices, things about usage, right? Usage per IV patient appointment, right? Are your clinicians using 4 catheters per patient, IV catheters, or 1 catheter? Wow, this location's actually using 11 catheters. Maybe there's a clinical problem there. Maybe you want to talk to the clinical staff and figure out what's going on. Maybe things are being ordered and it's an organizational problem. Maybe things are being ordered and left deep in a closet, right? But we allow people to actually load their sort of not patient data, nothing about the patient, but their sort of appointment data and categorize their appointments to see trends in usage across different appointments and where you might be overusing at specific locations versus other locations to sort of baseline. And with all that, we are working towards a solution that one day lets you go on autopilot, right? No more going on to, we talk about a single screen to conveniently shop all these suppliers. No more screen at all. No more supply chain at all. Your supply cabinet is stocked with everything you need whenever you need it. You have confidence that you're getting it at the best price from the best source at all times. And we're automatically ordering to meet your needs and your upcoming scheduled appointments in real time. And as appointments go up, your supply cabinets fill more. And as appointments, thin out for the summer, the supply cabinets level out. So you don't have expiring stock going into the fall.
So, Luka, I know you've developed this app and this platform here in the United States, and you work within the regulatory framework for supplies within the United States. So I think that's important to let folks know that you're not just lowering cost with off-label or unapproved supplies, but everything goes through the United States regulatory framework.
Absolutely. And for a lot of customers, even though we're only working with sort of custom U.S. Customs and FDA verified supplies, a lot of people are still uncomfortable with working with a new rep, right, or a new source that they haven't heard of. So we do obviously give businesses the option to choose the suppliers with whom they work. So if they only want to work with the big guys, you're still going to get 30, 40% savings by working with the big guys, the big brand house names.
So Luka, there's a whole untapped market for this as well internationally. A lot of money in healthcare in the United States and Europe and Australia, and indeed, a lot of the healthcare spending happens in those places. But 88% of the world lives in low and middle income countries, and they don't have access to all of these suppliers and supplies. This sort of intervention Is there any future for Grapevine in perhaps working in that space?
Yeah. The way I see it, and we've dabbled a little bit in trying to help out in international sort of emergency events where we can, right? We work very closely with a nonprofit called the AFIA Foundation, and a lot of our customers, being medical practices or hospitals, will have overstock of supplies or a sterile glove box that gets punctured, and now they need to throw it away. And there's very strict legislature surrounding, what you can and can't use in a medical setting. And as a result, a lot of perfectly usable medical supplies often get disposed of or thrown away. So we work with our customers to redirect their expiring stock, or we'll just call it bad stock, to people like the AFIA Foundation, who are able to redistribute that internationally and deliver it to sort of crisis zones that can make use of these supplies. So they don't just get dumped into a landfill, but they're getting repurposed and used to save lives internationally, provide care where there isn't any. And that's where we're at today. But I would really like to expand, our platform and expand our technology, so hospitals are not only sort of procuring and seeing usage in the clinical setting, but also managing inventory, and they themselves can very seamlessly. Not the whole AFIA relationship and donation relationship has been a more manual process, and it takes a lot of resources from us and the hospitals themselves, and it's hard to motivate good people to do those things when at the end of the day they are a business. So I would like to get to a point where solving back orders and solving overspend, the way that we solve it and we make it so effortless for businesses, we can translate that into sort of the redistribution of supplies from medical practices to crisis areas, for the benefit of all. If we can expand beyond the walls of America, I think that would be a profoundly impactful thing for us as a technology provider, and more importantly, like a solution provider. So I I also think that in areas where they do have supplies and their own manufacturers, different parts of Asia or Australia or parts of all sorts of parts of the world, that it would be great to find a partner that was willing to spearhead the use of our technology. At the end of the day, we're a software company, and we could clone the system, populate it with different suppliers that are trusted, right? And market it to a different network of customers internationally. That would be effortless for us today. We would need someone who is willing to do the work of basically getting supplier data loaded in, getting customers to speak in their language and delivering the value that we know we can. But if we could find a partner like that, I think that we'd be able to deliver more value quicker, without the build of new technology, just recycling and cloning existing technology.
All right, putting it out there for the big NGOs of the world, USAID, Bill and Melinda Gates, all you all listen here. um, it's important. Medical systems are in outside of the global north or have much less money to spend. They're smaller, they're less connected. And I think a technology like Grapevine could be huge to help them leverage the same interconnectedness and become part of the same large networks that will help them decrease costs and improve availability. We take a lot for granted in our very expensive healthcare system, but in much of the world, even vaccines aren't guaranteed. They can't be there all the time. Medications can come and go, and you could need life saving care and not have it. So, this is really, really important. Luka, what is your mom, the inspiration behind the first version of your business? Think about your developments so far in this space.
My mom is, my best friend, and she's very proud and appreciative that she has been, a huge part of the centerpiece of our creation here at Grapevine, and not just sort of the first iteration of our business, but she's been a champion for us all along the way, right? Both in telling us how to think, right, like a nurse or a supervisor that has to handle some of these supply chain management things, helping us find that moment that is, 11:59. And keeping us, believing and motivated even in moments of self-doubt. So I think there's a lot that a mom can do for a kid, even once they're a grown up. And my mom does just about all those things every day. So
And look at for a business like yours, having that real time frontline perspective is super important. You can easily lose touch with that, and nothing like a family member to speak truth to power. You're never the boss to them. You're just the kid, and they'll tell you if they don't think it's working or that you need to do something different. So I think it's very important and wonderful that you have that very real input from how this is impacting care on the front line.
yeah, and a lot of I remember panicking when I was finishing or halfway through college about going into the real world and becoming a grown up and how that would change my life. But I am very lucky and glad to say that I don't think I've ever had to grow up. I still get to, talk to my mom every day about what happened at school. Now it's work, but at school, a few times a week, I get to work here with my best friends. And honestly, not much has changed since I was 14, 15 years old. And I'm blessed to say that I feel that way. So this environment that, my mom and my friends and my co-founders have created for us is something that allows us to unlock, our potential and try to make a real positive difference and deliver health equity to providers and patients. So I'm grateful, incredibly grateful.
We're definitely wishing you well and much success. Luka, how can our audience connect with you and connect with Grapevine?
The easiest way to connect with Grapevine is on go-grapevine.com. That's go-grapevine.com. And you can sign up for free. Again, no cost, no burden. It'll take you 5 minutes and we'll be in contact with you shortly thereafter. If you want to get in touch with me directly, my email is luka at the same website, luka at go-grapevine.com.
Awesome. And thank you. Like I said, enjoy geeking out on healthcare supply chain innovation. This is very awesome. Appreciate you so much, Luka.
Thank you.
In our podcast, we frequently highlighted and explore the vital role of collaboration between public and private enterprise, backed by government support for sustainable health equity innovation. If you're a minister of health, public health officer, or dedicated public official working to enhance healthcare access and equity, A, Luka has a great intervention you might be interested in. B, we would love to have your voice on our show. Share your valuable insights and perspectives with our audience. Contact me at Dr. Dr. T at haew.org to secure your spot on the podcast. Listeners, we need your support too. Please share today's episode with a friend, leave us a review, share your thoughts. If you're interested in being a guest, please email us and visit https://haew.org to learn more, join us, partner, or contribute. Let's amplify the conversation for a healthier and more equitable world today.